Hey guys, now we're going to talk about bundle branch blocks. As we go through this, when we talk about the bundle branch block, we need to think about the bundle branches. We've been talking about the conduction pathway. We know that the electricity starts in the SA node and it travels down through the AV node. Now we're talking about issues once we get to the bundle branch. So when we talk about a bundle branch block, we know that the normal electricity starts up in this area from the SA node, and then it travels down through the atria, and then it gets to the AV node, and once it passes the AV node, we have the bundle of His, and then we break off into the right bundle branch, which is here, and the left bundle branch. So what we're going to discuss in this section is blocks that occur somewhere along the pathway of these bundle branches. So first we're going to talk about bundle branch blocks in general. These are seen with only supraventricular rhythms. And remember, when we talk about supraventricular rhythms, we're talking about rhythms that occur in the sinus node and in the atriums. We're not talking about rhythms that originate in the ventricle. Remember, supra means above the ventricle. So we're talking about, it can be a sinus rhythm, it can be an atrial rhythm, it can be a junctional rhythm. Anything that's happening above the ventricles is what we're referring to when we talk about a supraventricular rhythm here. Ventricular rhythms cannot exhibit bundle branch blocks, and the reason that is because the rhythm is originating in the ventricle, so it doesn't even have to travel down through the bundle branches because it's originating somewhere other than the SA node. So when we think about ventricular rhythms, the rhythm is starting somewhere down here in the ventricle, so you wouldn't see a block in a ventricular rhythm because it's not traveling the normal pathway from the top of the heart down through the AV node and following the pathway in this order. So with ventricular rhythms, you do not see the bundle branch blocks. Bundle branch blocks result in a wide QRS. They'll be greater than or equal to 0.12, and they'll have characteristic QRS shapes that we're going to talk about further. Bundle branch blocks are best seen in lead V1. So when we're determining a bundle branch block, we're going to most often always look in V1 to see what's going on. The normal anatomy of the bundle branch system includes the right bundle branch, which is located on the right side of the interventricular septum. So going back to this heart, this would be the right bundle branch. And then looking over here, this would be the left bundle branch, which has two divisions. And we'll see here that we have the posterior fascicle of the left bundle branch, and we have the anterior fascicle of the left bundle branch. So be familiar with that. When we're talking about the left bundle branch, there's some different things there that can happen. Moving forward, the bundle branch blocks happen when either the right or the left bundle branch becomes blocked. Electricity normally travels fast down through the healthy tissue, but what happens in the area of the block is the electricity slows at that area, and it may just trudge slowly through. So as a result, the ventricles may not beat together. So what would happen here, you know how we described in the past, the atrium contract, and then shortly after the ventricles contract, but both the right and the left atrium contract together, and then the right and the left ventricle contract together, but they don't both contract at the same time. Well, with the bundle branch block, the healthy side, just say there's a block on the left side, the atrium's working fine, the electricity's traveling the pathway, but when it gets here, let's say there's a block on the left, this current travels fast, just like it should, and the right side contracts. The left side, there's a block, so it trudges through slowly, so you have a little bit of a deviation. This side may not contract at the same time this side contracts because of the block. So you'll see something there on the EKG strip because they're not exactly working together. So moving forward, we need to discuss the difference of the impulse conduction. The difference in impulse conduction causes the ventricles to fire. They could fire consecutively instead of simultaneously, and that's what I was saying. So normally the ventricles fire simultaneously together, but because of the block, they fire consecutively now, which causes a wide QRS. And again, bundle branch blocks are seen in supraventricular rhythms. That's your sinus rhythms, your atrial rhythms, and your junctional rhythms. Remember, the impulse fires here, it travels down the pathway, and then we run into a hiccup along the lines of one of these bundle branches. If you have a ventricular rhythm, you're not going to see a bundle branch block because the rhythm is going to originate somewhere down here in the ventricles and it's not following the normal pathway. So the electrical impulse has to start in the normal pathway to make it down to the bundle branches for it to be a bundle branch block. Moving forward, let's talk about the right bundle branch block. You'll often hear this referred to as RBBB. With the right bundle branch block, the QRS complex typically starts out looking normal. Then the QRS has an extra R wave at the end. The extra R signifies that the current is lagging and dragging slowly. So that's why you see that extra R. So you'll have a QRS and then you'll have another R with the right bundle branch block. The second R wave is called the R prime, and it is written as R1, or not one, but it's written as R with this at the top. The block, this is a block of the right bundle branch. So when we flip back to the heart, we'll know that when we talk about a right bundle branch block, that it's occurring somewhere in this area of the right bundle branch. The QRS is greater than 0.12, and you have again that RSR configuration. And take note, the T wave slopes opposite of the QRS. So let's move to this and take a peek. You have the PQRS, you have your P, you can't see that, and then you have your QR, S, and then you see we have this third R. That's what we're talking about, an R on R. But take a look at this. The T wave is dipping downward. And remember, in the past we mentioned ischemia. You have to be really careful when you have a right bundle branch block not to confuse this with ischemia or an old heart attack, because it could very well indicate a inverted T wave can indicate ischemia. So we'll go through how to determine the difference in a right bundle branch block versus an old heart attack resulting in ischemia. But with the right bundle branch block, you will see a wide QRS complex, 0.12 or greater, and the T wave does slope in the opposite direction. Let's go now and let's talk about the left bundle branch block, the LBBB. This left bundle branch block can happen in two ways. It can happen, a block can be at the left common bundle branch, a part of the bundle branch before the fascicles, or it can be a block in both of the fascicles. But because we know the left side branches off into two different fascicles, the block can be in different locations. With the left bundle branch block, again, you see a wide QRS, 0.12 or greater, and the T wave slopes in the opposite terminal. The T wave slopes opposite of the QRS terminal. So again, it dips downward, so we have to be careful, or it may go upward. It is opposite. If the QRS is in a negative deflection, the T wave may be in an upward deflection. If the QRS is in a positive deflection, the T wave may dip down. So we have to be careful with that. So taking a peek here at the left bundle branch block, we'll see here where it talks about the QS or the RS configuration. This is just a bit different. You have the QRS, you don't have you don't have the R on R here, and you really just don't, you have more of a straight Q to an S. You don't have any of your normal little deflections here that you would see on a regular strip. Moving forward, we're now going to talk about bundle branch blocks that occur with certain heart rates. Blocks that are seen at only certain rates are called rate-related blocks. And when we hear the term critical rate, a critical rate is defined as the rate in which the block appears. So a rate at which the bundle branch block appears is called the critical rate. Conduction through the bundle branches is normal at heart rates below that critical rate. But once that critical rate is reached, one of the bundle branches may become incapable of depolarizing rapidly enough to allow normal conduction. So you have a bundle branch block that occurs. But with this bundle branch block disappears when the heart rate falls below that critical rate. Now, let's take a peek and look at the summary of criteria and causes of bundle branch blocks. I want you to look at the right bundle branch block, and you can see your RSR here. You've got your QRS, and then you have another R, and you see that you have a wide QRS interval, and the causes are coronary artery disease, conduction system lesions, normal variants, right ventricular hypertrophy, congenital heart disease, or right ventricular dilation. A left bundle branch block, this is your QS configuration in lead V1. You have a wide QRS complex, and the cause may be coronary artery disease, conduction system lesions, hypertension, or other organic heart disease. Moving forward, let's talk about the clinical implications of a bundle branch block. Bundle branch blocks are typically a symptom. They generally do not cause symptoms. They are the actual symptom themselves. And with a right bundle branch block, it can be seen in normal healthy hearts, and the left bundle branch block almost always implies cardiac disease here. And this puts the patient at risk for developing a severe AV block. So a person who has a bundle branch block needs to be watched closely. A new bundle branch block should prompt an immediate assessment of the patient. So we need to always make sure that we're monitoring these patients when we're dealing with the bundle branch block. Now we're going to talk about a Hemi block. A Hemi block is a block of one of the fascicles of the left bundle branch. There's two kinds. You have a left anterior Hemi block, which is an LAHB, and you have a left posterior Hemi block, LPHB. An LAHB results from left axis deviation. A LPHB results from right axis deviation. So when we're determining what type of block we have an algorithm that we're going to use. When you get to the end of that algorithm, we have to look at the axis deviation. The axis deviation, if we get all the way to that end, we know that to determine whether we have a left anterior Hemi block, that we're going to look for that left axis deviation. If we have a left posterior Hemi block, we're going to look for that right axis deviation. If we don't have any axis deviation at all, then that would mean that you don't have a Hemi block, which we will go into that further when we do our practice strips. But please take note of this slide right here, because you will need to know this portion. You'll need to know that if you have a left axis deviation, that would indicate an LAHB, or a right axis deviation would indicate an LPHB. So we can put that into context when we're working out the strips, and we work out the strips together. But for now, plant this to your memory. And I will be in touch with you guys, and we'll work out some strips together in class. But in the meantime, I want you to please kind of take note of everything that I just told you. And once we start working out these strips, it will make better sense. Thanks, and have a good day. And if you have any questions, please let me know.